Chlorpromazine is a phenothiazine antipsychotic used to treat nausea, vomiting, preoperative anxiety, schizophrenia, bipolar disorder, and severe behavioral problems in children. In this video, let's found. What is chlorpromazine? What class of drug is chlorpromazine? Is chlorpromazine used to treat? Who cannot use chlorpromazine? What are the side effects of taking chlorpromazine? How does chlorpromazine make you feel? How to use chlorpromazine? What is chlorpromazine? What class of drug is chlorpromazine? Chlorpromazine, marketed under the brand names Thorazine and Largactil among others, is an antipsychotic medication. It is primarily used to treat psychotic disorders such as schizophrenia. Other uses include the treatment of bipolar disorder, severe behavioral problems in children including those with attention deficit hyperactivity disorder, nausea and vomiting, anxiety before surgery, and hiccups that do not improve following other measures. Chlorpromazine was developed in 1950 and was the first antipsychotic on the market. It's on the World Health Organization's list of essential medicines. Its introduction has been labeled as one of the great advances in the history of psychiatry. It is available as a generic medication. What is chlorpromazine used to treat? For the treatment of schizophrenia, to control nausea and vomiting, for relief of restlessness and apprehension before surgery, for acute intermittent porphyria, as an adjunct in the treatment of tetanus. To control the manifestations of the manic type of manic depressive illness, relief of intractable hiccups. For the treatment of severe behavioral problems in children, 1 to 12 years of age, marked by combativeness and/or explosive hyperexcitable behavior, out of proportion to immediate provocations. And in the short-term treatment of hyperactive children who show excessive motor activity accompanying conduct disorders consisting of some or all of the following symptoms: impulsivity, difficulty sustaining attention, aggressivity, mood lability, and poor frustration tolerance. Who cannot use chlorpromazine? Hypersensitivity to phenothiazines. Coma, severe hypotension, severe central nervous system, CNS, depression, concurrent administration of large amounts of CNS depressants, subcortical brain damage, poorly controlled seizure disorder. Severe vascular disease. What are the side effects of taking chlorpromazine? Chlorpromazine may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Dizziness, feeling unsteady, or having trouble keeping your balance. Blank facial expression. Shuffling walk. Restlessness. Agitation. Nervousness. Unusual, slowed, or uncontrollable movements of any part of the body. Difficulty falling asleep or staying asleep. Pharmacodynamics. Chlorpromazine is a psychotropic agent indicated for the treatment of schizophrenia. It also exerts sedative and antiemetic activity. Chlorpromazine has actions at all levels of the central nervous system, primarily at subcortical levels as well as on multiple organ systems. Chlorpromazine has strong antiadrenergic and weaker peripheral anticholinergic activity. Ganglionic blocking action is relatively slight. It also possesses slight antihistaminic and anti-serotonin activity. How does chlorpromazine work? Chlorpromazine acts as an antagonist, blocking agent, on different postsynaptic receptors on dopaminergic receptors, subtypes D1, D2, D3, and D4 different antipsychotic properties on productive and unproductive symptoms. On serotonergic receptor 5-HT1 and 5-HT2, with anxiolytic, antidepressive and anti-aggressive properties as well as an attenuation of extrapyramidal side effects, but also leading to weight gain, fall in blood pressure, sedation and ejaculation difficulties. On histaminergic receptors, H1 receptors, antiemesis, vertigo, fall in blood pressure and weight gain, alpha-1/alpha-2 receptors, antisympathomimetic properties, lowering of blood pressure, reflex tachycardia, vertigo, sedation, hypersalivation and incontinence as well as sexual dysfunction, but may also attenuate Parkinsonism, controversial, and finally on muscarinic, cholinergic, M1/M2 receptors, causing anticholinergic symptoms like dry mouth, blurred vision, obstipation, difficulty/inability to urinate, sinus tachycardia, ECG changes, and loss of memory, but the anticholinergic action may attenuate extrapyramidal side effects. Additionally, chlorpromazine is a weak presynaptic inhibitor of dopamine reuptake, which may lead to mild, antidepressive and antiparkinsonian effects. This action could also account for psychomotor agitation and amplification of psychosis, rarely noted in clinical use. Half-life: 30 hours. How to use chlorpromazine? Schizophrenia, psychotic disorders. PO, 30 to 75 mg/day divided Q6-12 HR initially, maintenance, usually 200 mg per day, up to 800 mg per day in some patients. Some patients may require 1 to 2 g day. 4/IM, 25 mg initially, followed PRN with 25 to 50 mg after 1 to 4 hours. Then increased to maximum of 400 mg Q4-6 HR until patient is controlled, usual dosage 300 to 800 mg/day. Nausea and vomiting. PO, 10 to 25 mg Q4-6 HR, PRN. 4/IM, 25 to 50 mg Q4-6 HR, PRN. Preoperative apprehension. 25 to 50 mg PO 3 hours before surgery. 12.5 to 25 mg IM 1 to 2 hours before surgery. Intraoperative sedation. 12.5 IM Q 30 minute or 2 mg 4 Q 2 minute, total dose not to exceed 25 mg, intractable hiccup. 25 to 50 mg PO Q6-8 HR. If hiccups persist after 2 to 3 days of oral therapy, administer 25 to 50 mg IM Q3-4 HR. If symptoms persist, administer 25 to 50 mg by slow 4 infusion with patient lying flat in bed. Monitor BP acute intermittent porphyria. 25 to 50 mg PO Q6-8 HR migraine headache, off-label. 5 to 50 mg 4 as single dose. Are there specific concerns about chlorpromazine and pregnancy? U.S. FDA pregnancy category, not assigned. Risk summary: malformative risk in pregnant women is unknown. Extrapyramidal side effects and withdrawal symptoms have been reported in exposed neonates. And embryo and toxicity have occurred in animal models. That's all the information about chlorpromazine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.